Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert, along with Dr. Millicent Ravello, the Facelift duo.
I like the sound of that.
Well, we have been facelifting a lot of people lately, and I wanted to bring up a topic with you today.
What's that?
It happened today when a patient came to me and said, do you do this very specific branded facelift technique?
Trademark. TM.
Like trademarked,
registered.
whatever. And I said, of course I do. That's a deep plane facelift. And she goes, so you do that? I was like, yeah, I do. It's like,
And so do a lot of
and so does everybody else, because it's a really nice
Actually.
technique. And I do some other techniques too. I do SMAS flaps. I do SMASectomies. I'll do plication sometimes. And she goes, oh, but I really want this blah, blah, blah branded technique. I go, no problem. I go, however, I do want to bring something up with you. And by the way, you're a deep plane facelifter as well.
Yeah, deep plane's fantastic.
You like it.
Yeah, it's great.
I think we all like it. It's
Yeah,
really
it's good.
kind of come into vogue. And we've talked, there's a whole podcast about the deep plane
Yeah.
facelift. There's a podcast about the SMAS facelift. There's podcasts about plication. We talk facelifts because we like doing them. We're
Right.
just, we're into it. And our patients are into it, and they're into the results. And she came to me because she's like, I saw your results on your Instagram. They're insane. I was like, yeah, they look great. So she says, I want the deep plane. I go, great. I go, however, you have had a facelift before. So, no, you just said, what went off in your head when you said that? Because I saw the light bulb like over your head, like, wait a second.
Well, actually, the deep plane facelift is actually great for revision facelifts. But that being said, you sort of kind of have to look at the face and see what's already been done and lifted. So it's not a one-size-fits-all technique.
Exactly. And that's what went off in my head, too, as I said, but you've had a facelift before. So can I do the deep plane on you? Maybe. In all likelihood, I can, because previously, not everybody was doing deep plane facelifts, and she had it, 15 years ago. So, which, by the way, I was doing deep plane facelifts then. It's just I would do more SMAS flaps than I would do the deep plane facelift. And the reason I like the SMAS flap is because I would use it to get to the deep plane. And then a bunch of people came along and said, like, well, why do you need all that SMAS up? Why don't you just go right to the deep plane? And I was like, yeah, why not? And it was really Dan Baker that got me to think that with his SMASectomies, because he was like, yeah, you don't need to do all this up here. Just get down to where the action is. And that makes a lot of sense. So I said, but for you, I'm going to do whatever technique's going to give you the best result. And I said, I am not a one-trick pony. And the deep plane probably will be the best way to go just because it is a revision facelift. But it doesn't necessarily mean that that's going to be what I do.
Right. Because that might not be what she needs.
Right. Maybe she just needs a plication.
Yeah.
Maybe she needs more of a flap creation. Maybe she needs, a SMASectomy, which I love that technique. And, it's really... the SMASectomy is a great way to go, especially in revision facelifts, because if they've done a SMAS flap or a deep plane, you can still remove some of it and bring it up.
Yep. You can always bring a little more up.
It's a great technique. So I just wanted to just throw that out there that, yes, I understand that there are surgeons spending loads and loads of money on PR to brand these facelift techniques. And I get that. And good for them because, by the way, we're all doing more facelifts because of it.
Right.
It's really true. And I don't fault them for wanting to, have their trademark and their name and all that. And it's cool. But at the same time, for Tracy in Wisconsin, it's all the same thing.
It's literally, yes, every surgeon,
Well,
more
it's
or less
because of different surgeons doing it.
It's different because different surgeons are doing it, but in general, a lot of the techniques are the same.
And it's not that they're exactly the same,
No.
because the way that the surgeon tensions the flap and the way that they cut it and where they cut it and how they it is really individualized, which is why we always come back to the take-home message, which is look at the before and after photos and look at them very critically and say, would I like to look like that? And if you would, then that's where you go.
Then great.
And if you think that it isn't for you, then don't go there and look elsewhere. But it is all about the results, because that's why you have plastic surgery.
I couldn't agree more.